Lecture Part 2, The Silent Rise of Kidney Disease. What science reveals and how you can protect yourself. Good morning, friends. Before we begin today's discussion on prevention and practical steps, let me share a short story. A middle-aged woman came for consultation, not because she was very sick, but because she had attended a health talk a few weeks earlier. In that talk, she heard something that stayed in her mind. Kidney disease begins silently. She said that sentence kept coming back to her. She did not have major symptoms, but she noticed small things, slight tiredness, occasional swelling in the feet, and irregular eating habits due to her busy schedule. Unlike most people, she did not ignore it. Instead, she made a decision. She said, "Before something becomes serious, let me correct what I can." Now, here is what she did. Not something complicated, not expensive, not extreme. She started her day with a glass of water with a few drops of lemon. She consciously increased her intake of vegetables, simple ones like cabbage, carrots, and green beans. She replaced some processed foods with home-cooked meals. She began walking for 20-30 minutes daily. She reduced unnecessary snacking and tried to keep her meals more balanced. She started using a little turmeric, garlic, and ginger regularly in her cooking. She improved her sleep timing. These were small changes, nothing dramatic, but she followed them consistently. After a few months, she returned, not with complaints, but with a sense of improvement. Her energy had improved, her sleep was better, her blood pressure had stabilized, and most importantly, her reports showed improvement in early markers that were previously borderline. But what was more important than the reports was what she said. She said, "I did not feel sick before, but now I feel better than before." This is a very important statement because it shows something clearly. Health is not just the absence of disease. Health is a state of better function, better energy, better balance. Key message from the story. Most people wait. They wait for pain, clear diagnosis, severe symptoms. But by then, the opportunity for easy correction becomes smaller. This woman did something different. She acted before the disease progressed. Now, back to our discussion. So today, this is what we are going to focus on. Not what happens when the kidneys fail, but what we can do before that happens. How we can protect kidney function daily, how simple habits can prevent long-term damage. Framing the session. This session is not about complicated treatments. It is about daily food choices, daily habits, daily awareness, because ultimately, your daily routine becomes your long-term health outcome. Powerful bridge line. Let us now move from understanding to application, because knowing is useful, but applying, that is what protects your kidneys. In the previous session, we understood something very important. Kidney disease does not begin suddenly. It develops slowly, silently over years, through small imbalances in lifestyle, metabolism, and vascular health. Most people do not notice it in the beginning because the kidneys are remarkably silent organs. They continue to function even when there is early damage, and because of this, people often feel normal until a significant portion of function is already compromised. Now, the most important question arises: can we do something about it? The answer is very encouraging. Yes, we can. In fact, in many cases, especially in the early stages, kidney dysfunction can be prevented, slowed, and sometimes partially improved if we act at the right time and in the right way. But there is one important condition. We must move from general advice to specific daily action. Because unless we clearly identify what to do, what to eat, and how to live, nothing changes. So today, this lecture is not theoretical. It is practical. It is something you can begin applying from today itself. Let us begin with a simple principle. Kidney protection is not achieved through one medicine or one supplement. It is achieved through a combination of small, consistent daily habits that support the body's internal balance. Among these, diet plays a central role. But again, we must not say, eat healthy in a general way. That is not enough. We must clearly identify which foods support kidney health and why. Let us start with green leafy vegetables. Green leafy vegetables are highly beneficial because they provide antioxidants, fiber, and essential micronutrients that reduce inflammation and oxidative stress. These two factors are major contributors to kidney damage over time. When you consume green leafy vegetables regularly, they help improve metabolic balance and support vascular health, which directly protects the delicate filtering system of the kidneys. They also reduce toxin load, making the kidneys work easier. Next, green beans. Green beans are particularly useful because they are light, low in sodium, and gentle on the kidneys. They provide important vitamins and plant compounds that support circulation and reduce inflammation. Unlike heavy or processed foods, green beans do not overload the kidneys. They help maintain fluid balance and are easy to include in daily meals. Now, carrots. Carrots are rich in beta-carotene and antioxidants, which help protect cells from oxidative damage. They also support blood sugar regulation, which is very important because unstable blood sugar contributes to kidney damage over time. By supporting metabolic balance, carrots indirectly reduce stress on the kidneys. Let us consider cabbage. Cabbage is one of the most kidney-friendly vegetables because it is low in potassium and rich in antioxidants and fiber. It helps reduce inflammation and supports gut health. A healthy gut reduces toxin production, which means less burden on the kidneys. This makes cabbage an excellent choice for regular consumption. Next is cauliflower. Cauliflower contains compounds that support detoxification and reduce inflammation. It is also relatively low in potassium compared to many vegetables, making it suitable for kidney health. Its fiber content supports metabolic balance and helps reduce the buildup of waste products. Now, broccoli. Broccoli contains powerful compounds like sulforaphane, which help reduce oxidative stress and inflammation. It also supports vascular health and stabilizes blood sugar levels. Since kidney function is closely linked to vascular health, broccoli plays an important protective role. Let us now look at cucumber. Cucumber is highly hydrating and helps dilute toxins in the body. Since the kidneys depend on adequate fluid for proper filtration, cucumber supports this process naturally. It is light, easy to digest, and helps reduce the overall workload on the kidneys. Next, lemon. Lemon provides natural citrate, which helps prevent kidney stone formation and supports detoxification. Lemon water also encourages better hydration and helps maintain acid-base balance in the body. This makes it a simple but powerful addition to daily routine. Now, barley water. Barley water is traditionally used to support kidney health because it promotes urine flow and helps flush out toxins. It also supports metabolic health through its fiber content and helps reduce inflammation. Let us discuss ginger. Ginger has strong anti-inflammatory and antioxidant properties. It improves circulation and digestion, and by supporting metabolic balance, it reduces the burden on the kidneys. Next, garlic. Garlic supports vascular health by improving blood flow and reducing blood pressure. It also reduces inflammation and protects the small blood vessels in the kidneys. This makes it very valuable in long-term kidney protection. Now, turmeric. Turmeric contains curcumin, which is a powerful anti-inflammatory compound. It helps reduce oxidative damage and supports vascular and metabolic health, both of which are essential for kidney function. Let us consider cinnamon. Cinnamon helps regulate blood sugar and improves insulin sensitivity. Since insulin resistance is a major driver of kidney damage, cinnamon indirectly plays a protective role. It also provides antioxidant support. Next, olive oil. Olive oil contains healthy fats and antioxidants that reduce inflammation and support endothelial function. Healthy blood vessels are essential for proper kidney filtration, and olive oil helps maintain this. Now let us move to targeted nutritional support. First, benfotiamine. Benfotiamine helps block harmful pathways activated by high blood sugar, such as glycation and oxidative stress. By protecting endothelial cells, it helps preserve the microvascular system of the kidneys. Next, methylcobalamin, vitamin B12. Methylcobalamin supports nerve and vascular health and helps regulate homocysteine levels. This reduces vascular damage and supports proper kidney circulation. Now, omega-3 fatty acids. Omega-3 fatty acids reduce inflammation and improve blood vessel function. They support renal circulation and help reduce early kidney damage. Next, apple cider vinegar, ACV. When used in diluted form, ACV supports metabolic balance and improves insulin sensitivity. This indirectly reduces stress on the kidneys. Now, vitamin K2. Vitamin K2 helps direct calcium into bones and prevents its deposition in blood vessels. This maintains vascular flexibility and supports proper kidney perfusion. Finally, magnesium glycinate. Magnesium supports blood pressure control, improves insulin sensitivity, and helps relax blood vessels. All of these contribute to kidney protection. At this point, it is important to pause and reflect. These are not random items. Each one has a specific role. You do not need to start everything at once. Start with a few, make them part of your routine, then gradually expand. Beyond diet and supplements, lifestyle plays an equally important role. Hydration must be maintained consistently, not excessive, but regular and adequate. Movement must be part of daily life. Even simple walking improves circulation and supports kidney function. Sleep must be prioritized, as it is the time when the body repairs itself. Stress must be managed, because chronic stress reduces kidney blood flow and increases inflammation. Medication use must be mindful, avoiding unnecessary strain on the kidneys. Let me now bring everything together. Kidney health is not protected by one action. It is protected by a pattern of living. A pattern that includes: most important is control of insulin resistance and blood pressure, right food, right hydration, regular movement, good sleep, stress balance, metabolic control. When these are aligned, the body creates an internal environment that supports kidney function naturally. Practical foundations beyond diet. After understanding the role of specific foods and supplements, it is equally important to recognize that kidney protection does not depend on diet alone. The kidneys function within a larger system, and several daily lifestyle factors directly influence their health. If these are not addressed, even the best diet will have limited effect. Therefore, let us now look at each of these factors individually and understand how they can be applied in daily life. Hydration, supporting kidney flow. Hydration is one of the most fundamental and often neglected aspects of kidney health. The kidneys rely on adequate fluid to filter blood efficiently and remove waste products. When water intake is insufficient, urine becomes concentrated, toxins accumulate, and the workload on the kidneys increases. Over time, this can contribute to damage. However, hydration should be consistent rather than excessive. Drinking moderate amounts of water regularly throughout the day supports continuous filtration. Starting the day with water, maintaining steady intake, and reducing reliance on sugary or caffeinated beverages are simple but powerful steps. Hydration can be further supported by natural fluids such as lemon water or barley water, which not only provide hydration but also support detoxification and metabolic balance. Movement, improving circulation. The kidneys depend heavily on proper blood circulation. Regular movement improves blood flow, supports vascular flexibility, and enhances oxygen delivery to kidney tissues. A sedentary lifestyle, on the other hand, reduces circulation, promotes metabolic dysfunction, and contributes to vascular stiffness, all of which negatively affect kidney function. Daily walking, light physical activity, and avoiding prolonged sitting can significantly improve circulation. Movement should not be viewed only as exercise, but as a necessary process to maintain internal flow and organ health. Sleep, the repair phase. Sleep is the time when the body undergoes repair and restoration. Poor sleep disrupts hormonal balance, increases stress hormones, and contributes to elevated blood pressure and inflammation. These changes directly affect kidney function over time. Maintaining a regular sleep schedule, reducing screen exposure before bedtime, and ensuring a calm sleep environment are essential. Good sleep supports not only the kidneys, but overall metabolic and vascular health. Stress, the silent strain. Chronic stress is a major but often overlooked factor in kidney health. It activates the sympathetic nervous system and increases cortisol and adrenaline levels. This leads to vasoconstriction, reduced blood flow to the kidneys, and increased blood pressure. Over time, this creates a sustained strain on the renal system. Managing stress through simple practices such as deep breathing, meditation, prayer, or spending time in nature can help restore balance. Stress reduction is not optional. It is essential for protecting internal organs. Glucose spikes and insulin resistance. Frequent spikes in blood sugar, often caused by refined carbohydrates and irregular eating patterns, lead to repeated insulin surges. Over time, this results in insulin resistance, which is a major contributor to vascular damage. High insulin levels promote sodium retention, increase blood pressure, and damage the delicate microvasculature of the kidneys. Controlling glucose spikes through balanced meals, reducing refined sugars, and maintaining regular eating patterns is a key step in protecting kidney function. Stable blood sugar supports stable vascular health. Glucose spikes and insulin resistance. Frequent spikes in blood sugar, often caused by refined carbohydrates and irregular eating patterns, lead to repeated insulin surges. Over time, this results in insulin resistance, which is a major contributor to vascular damage. High insulin levels promote sodium retention, increase blood pressure, and damage the delicate microvasculature of the kidneys. Controlling glucose spikes through balanced meals, reducing refined sugars, and maintaining regular eating patterns is a key step in protecting kidney function. Stable blood sugar supports stable vascular health. For effective kidney protection, one of the most important preventive strategies is controlling blood pressure and preventing insulin resistance, and both of these are deeply influenced by glucose spikes. Frequent rises in blood sugar, especially from refined carbohydrates and irregular eating patterns, lead to repeated insulin surges. Over time, this causes insulin resistance, where the body requires higher levels of insulin to maintain normal glucose levels. Chronically elevated insulin promotes sodium retention, increases sympathetic nervous system activity, and leads to sustained elevation of blood pressure. At the same time, Glucose spikes and insulin resistance damage the endothelial lining of blood vessels, including the delicate microvasculature of the kidneys, leading to reduced filtration efficiency and progressive injury. Since the kidneys are highly dependent on stable blood flow and vascular integrity, this combination of hypertension and metabolic dysfunction becomes a primary driver of kidney disease. Therefore, preventing glucose spikes through mindful eating, balanced meals, and metabolic regulation is not just about controlling sugar levels. It is a fundamental strategy to protect kidney structure and function over the long term. If you control glucose spikes, you control insulin resistance. If you control insulin resistance, you control blood pressure. And if you control both, you protect your kidneys. Nephrotoxic medications, hidden risk. Many commonly used medications can have adverse effects on the kidneys, especially when used frequently or without proper monitoring. Painkillers, certain antibiotics, and long-term use of some drugs can reduce kidney blood flow or cause direct toxicity. The risk increases when combined with dehydration or existing metabolic stress. Therefore, medication should be used only when necessary and under supervision. Awareness of this factor can prevent avoidable kidney damage. Toxin exposure, reducing the load. In modern life, exposure to environmental toxins is increasing through food, water, air, and household products. The kidneys are responsible for filtering these substances, and excessive exposure increases their workload. Reducing intake of processed foods, choosing fresh and natural options, ensuring clean drinking water, and minimizing unnecessary chemical exposure can significantly reduce this burden. Lower toxin load means less stress on the kidneys. Microcirculation and vascular health. The kidneys contain a highly delicate network of micro blood vessels. These vessels are responsible for filtration, and their health is critical for kidney function. Conditions such as hypertension, insulin resistance, and inflammation damage these vessels over time. Supporting vascular health through proper nutrition, blood pressure control, and circulation-enhancing practices helps preserve kidney function. This is why many of the earlier discussed foods and supplements focus on endothelial health, cellular energy, mitochondrial function. Kidney cells require a high amount of energy to perform their functions. This energy is produced by mitochondria within the cells. When mitochondrial function is impaired due to poor nutrition, oxidative stress, or chronic disease, kidney cells cannot function or repair effectively. Supporting cellular energy through proper nutrition, B vitamins, magnesium, and overall metabolic balance helps maintain kidney function at a fundamental level. Role of energy medicine, integrative perspective. From an integrative approach, therapies that support microcirculation and cellular energy may provide additional benefits. Modalities such as red and near-infrared light therapy, pulsed electromagnetic field, PEMF, therapy, and molecular hydrogen have been explored for their ability to improve mitochondrial function, reduce oxidative stress, and enhance circulation. While these are supportive and not replacements for lifestyle changes, they may complement a comprehensive kidney care approach when used appropriately. Bringing it all together. When we look at all these factors together, a clear picture emerges. Kidney health is not dependent on one single factor. It is influenced by what we eat, how much we hydrate, how we move, how we sleep, how we manage stress, how we control metabolism, what we are exposed to. Each of these plays a role. Each of these is modifiable. Thank you. Founder, Holistic Wellness Foundation, IMFAO, Healing beyond boundaries.